Hello, my friends, and welcome to the Pathway channel. Today, I will discuss with you the follicular thyroid carcinoma. And I will mention a few points about this carcinoma before we start our microscopic view. So the follicular thyroid carcinoma is a malignant epithelial tumor of the thyroid, and it's lacking the papillary features as for the papillary thyroid carcinoma. The risk factors are iodine deficiency and maybe previous radiation. And sometimes it happens, of course, in the familial syndromes. And in this case, it might be not only like affecting one lobe of the thyroid, but it may be bilateral. For the diagnostic checklist or things that we will search for on the slide, the most important thing is the capsular invasion, which we need to have the tumor penetrating the whole thickness of the capsule. And the second thing is vascular invasion. And when we speak about vascular invasion, we mean vessels outside the tumor itself, outside the capsule. So this will be considered as vascular invasion, and we need the tumor to be adherent to the vascular wall, covered by the endothelium, or in the context of a thrombus or fibrin. And from the microscopic picture and having these two important points, we need also to differentiate whether it's adenoma or it's any other benign or any other malignant condition. So let's go on the slide. So here we are at the 2.5x, and I will start with this view because this is sharing the normal thyroid tissue on this side. And as you can see here, we have these follicles lined by the follicular cells, and we have here the thyroglobulin, and in between, like the blood vessels and other maybe some inflammatory cells. But this is the main thyroid tissue. This area is the main thyroid tissue. And then if we move to this direction, we will find here a thick capsule. And beneath this capsule, we will start to see this follicular thyroid carcinoma. Yeah. And for the microscopic view, from this power, some follicles, which are considered like some remnants of the thyroid or original thyroid tissue. And here also we can see other follicles. We saw previously the normal thyroid tissue, so I hope you can appreciate these small follicles as same as these ones outside. So this is the first feature we will consider. The pattern itself of this tumor is maybe trabecular, and it's not papillary. So it's not the papillary thyroid carcinoma. So it's the follicular thyroid carcinoma. The other feature I want to share with you here is the capsular invasion, because I mentioned this is a very important prognostic thing in this tumor. So if you can see here, this is the capsule, the thick capsule, and it's moving here. And then all of a sudden, you will find this capsule like ending, and you will find that the tumor here is lacking this capsule. So it invaded the whole thickness of the capsule. And here the capsule will start again. So this tumor fulfilled the first criteria of being aggressive by invading the capsule. This is number one. And I will show you later the vascular invasion. Here again, we can find some thyroid tissue still present, but the main thing is these sheets of malignant cells. And we will go on a high power just to see them more and compare them with the normal tissue. So I will go on a high power on this area, maybe just to see the normal thyroid in comparison with the carcinoma one. So this is the 20x, and as you can see here, we have some still remnants of this thyroid tissue, okay? And these are all malignant cells around it. And if we look finally, we may find mitotic figures, which again indicates that this is a malignant tumor. And if we go up here, you might, this is the capsule of this tumor. And after the capsule, we will go for the normal thyroid tissue. I will show you now the vascular invasion for this patient, which indicates, again, an aggressive tumor. So getting back to our follicular thyroid carcinoma, this is the cancer. And here outside the capsule, as we mentioned, we need vessel, which is outside the tumor itself. So this one, I hope I can convince you that this is a blood vessel. And to make sure that this is a blood vessel, you can throw some stains like the CD31 to indicate that this is a blood vessel. And if it is lined by the stain, then these are cancer cells that invaded the blood vessel. And we did this and it proved to be a blood vessel. So this is the second criteria of being an aggressive tumor, invading the blood vessels. Thank you so much for watching the video. And if you like it, please subscribe.